Hi, everyone. My name is Jennifer DeCams, and I am one of the marketing managers at Scio Plus, the company behind the brands Utiva and Ferosom. I want to thank you all for taking time out of your busy evening to listen in to this live webinar titled Nutritional Supplements for UTI, Overactive Bladder, and Iron Deficiency with registered dietitian Kelly Reinprecht. Before we introduce Kelly, I want to thank our partners, the Big Carrot, for collaborating with us on this opportunity to host the talk. During the talk, we welcome you to post your questions in the Q&A box so we can queue them for the speaker. We will take 30 minutes for presentation, followed by 30 minutes for Q&A. I want to remind everyone that this talk is recorded and we will post a replay on YouTube for you to access later. I also want to mention that until the end of the month, there is an in-store discount at the Big Carrot of 15% off on both Utiva and Ferosom products. But for anyone not in the Toronto area, as we can see that a lot of you are from other cities, we also have a 15% off discount for new customers on both our websites. So without further ado, let's introduce Kelly. Kelly is a registered dietitian with 15 years of practice, helping people of all ages and all abilities to maximize health and their well-being through nutrition. She has a particular interest in brain health, inflammation, and nutritional deficiencies related to the modern diet. She believes that everyone deserves the facts on food and nutrition in order to take the stressing and guessing out of eating a healthy diet. Everyone, please give a warm welcome to Kelly.
Thank you. Thank you so much. I'll start presenting my slides now. 15 years. Yeah, that went pretty fast. So let me know if you can see this well, Jen. Just share my screen. Sorry, guys.
Yes, we can see your screen, Kelly.
Just wait. I picked the wrong one. So yeah, thank you for summarizing that. I do have a special interest in nutrition for brain health. And I have a history of working as a dietitian here in Alberta for the last 15 years, really working with the elderly, and more recently specializing in working with those with mental illness, neurodivergence, dementia, and just general stress on the nervous system. There we go. Oh, for Pete's sakes. Play from start. You've got it now, right?
Yeah, we can see.
Okay, so sorry about the wait there, but yeah, so today I will talk about nutritional supplements for managing iron deficiency anemia and bladder health. We are welcoming questions as the talk goes on. You can enter those into the chat and we'll address those at the end. And thank you so much for inviting me to deliver this talk. I am excited to talk about the Ferosom Forte supplements as well as the Utiva product line. All right, so before we get started, I just wanted to say hello and welcome from the traditional lands of Treaty 6 territory, where I'm grateful to be speaking from today. And in the spirit of reconciliation, I really wanted to bring our awareness to the rich history of natural health remedies used by Indigenous people from all of the lands that we gather from today. You know, it's really quite amazing to consider. And you see here a beautiful sketch of the cranberry plant, as well as a picture of some bright red cranberries. And cranberries are an excellent example of a natural health product native to eastern coastal areas where they grow in sandy areas. The cranberry was a superfood for tens of thousands of years before the first settlers arrived in the New World. It was one of the important foods that was first shared between Indigenous people and the Europeans, and it was even thought to be at the very first Thanksgiving. So the cranberry helped the Indigenous people to survive for a millennia, and in turn helped the European people to prevent disease while traveling at sea. So it's quite marvelous to imagine that we're still unlocking the health benefits of the cranberry. And today we will talk about two products that harness active ingredients in cranberries, Utiva Bladder Health and Utiva Cranberry Packs. So, as mentioned, we will review supplements for bladder health and anemia, and we'll also discuss common symptoms and steps you can take to manage UTIs and anemia. I really hope that you take knowledge away from today's talk that will allow you to take an active role in managing your health. We've planned ample time for questions today, so please feel free to enter these, open to any nutrition-related questions, and I'll try and answer them the best that I can. I really love questions. I feel like that is one of the best ways to learn. And I've also listed here some great resources. So for those that are looking for a registered dietitian, I recommend visiting the dietitiandirectory.com. You can find a dietitian that practices in your province, as we are specific to our practice areas. I do highly recommend working with a dietitian for anyone interested in learning more about their unique nutrition needs. Today's talk will cover general information, but of course can't replace individual assessments from your dietitian or physician. If you are looking for more information on nutrition, I definitely recommend heading to unlockfood.ca. That is a source of credible and reliable nutrition information from the Dietitians of Canada. So we'll begin today by talking about UTIs, urinary tract infections. They are one of the most prevalent infections worldwide. About 40% of women in particular will suffer from a urinary tract infection, many of whom will have repeat infections within the year and or what is called recurrent, so within about 6 months and maybe more than once or ongoing. UTIs are caused by bacteria, most commonly actually the E. coli bacteria that adheres to the bladder wall. You can see a picture of the bladder here, and the bladder wall is exactly where the bacteria adhere, and there they multiply, causing trouble. You'll know that you're suffering from UTI usually by the symptoms, which include increased urinary frequency and urgency, pelvic pain, pain with urination, or blood in the urine. So quite frankly, very uncomfortable. Less common symptoms, but that can occur, are just feeling sick, feeling crummy, having fever or chills, being nauseated, or having a back pain, a high back pain near where the kidneys are. So those symptoms are less common and may indicate a more complex infection and should be addressed immediately. I just wanted to mention that. I also hear mentioned that you may see a change in behavior or confusion, often among those that are elderly or have chronic diseases like neuromuscular disorders, multiple sclerosis, or people living with catheters. They'll just seem a bit off. And sometimes even children, you'll notice that their behavior is off or they're seeming different, and that can actually indicate that UTI is brewing. So the good news is that you can take steps to aid your bladder health, and you should do so at the first sign of infection. So number one is to increase your fluid intake. And I love to talk about this topic because so often people are really unclear on the amount of fluid that they should have. So most adults need 9 to 12 cups of fluid per day, and that's from all fluid sources. So everything counts: smoothies, tea, juice. Of course, water is best, and ideally about half of your fluid intake or more will come from water. The best way to drink more is to start measuring and to keep measuring to ensure you hit your target intake. This helps to flush the bladder and clear away bacteria naturally. That 9 to 12 cups can vary depending on your age, and of course, you need more fluid when it's hot or dry or when you're more active. It's also true that another key source of fluid is your diet, and most people don't realize that. So, choosing dark colored fruits, vegetables, and berries not only contributes vitamins, minerals, and antioxidants, they actually contribute a portion of your daily fluid intake. And I use this trick with people quite often because there's a lot of us that aren't as good at drinking fluid as we would like to be. So eating more high fluid fruits and vegetables can do the trick. So things like cucumber and watermelon or juicy oranges can help you to increase that fluid in your diet as well. You also always want to support and consider your healthy bladder and bowel function. So this is like very important to fully empty your bladder. And double voiding is a trick that is often taught. So that's going to the bathroom and then waiting a few moments, even moving your position, and then going again, because quite often there can be some residual urine to clear, and this helps to remove any additional bacterial load. It's also important to get to the bathroom when you need to go to the bathroom. That can be a challenge for certain people in certain occupations. I know teachers, truck drivers, nurses in particular. You really have to prioritize getting those bio breaks to ensure that you're clearing your bladder. Also, another passion of mine that I could talk all day about is managing constipation. I really can't overstate the importance of managing constipation, as it really can negatively impact your urinary function. So constipation is best managed with fluid, sources of fiber, the addition of a probiotic supplement or probiotic containing food, and even some foods that act as a natural laxative like prune juice or prunes can be used. Whatever it takes, you've got to make sure that the bowels are moving. And obviously, you want to eat a healthy diet to support your immune system. This really means eating mainly whole, unprocessed foods. So these are the foods that don't have a label, or if they do, they have very few ingredients, and you can pronounce all of those ingredients. These are nutrient-dense foods that will support your overall health and keep your immune system in top shape. So it is possible that the initial symptoms of a UTI resolve on their own. About 20% of cases in a healthy adult, that is the case. But if symptoms persist, antibiotics are the standard treatment. And so you need to seek advice from your doctor and to follow any prescribed antibiotics and fully complete any prescriptions. I mean, no one wants to go on antibiotics, but they are necessary. One trick, though, is that you can consider using the Utiva cranberry packs, which can be used as an adjunct therapy to go along with antibiotics to speed up recovery or time to reduce symptoms, and also can be used to prevent recurrent infections. So these are the Utiva cranberry packs, which are available for purchase, and they contain what are called proanthocyanidins, packs for short. And these are the key ingredients in cranberries that prevent UTIs. In fact, we now know that 36 milligrams of packs daily are proven to be effective in the prevention of UTIs. So for people that have recurrent UTIs, in the past, or even presently, I suppose, you could take prophylactic antibiotics in order to prevent recurrent UTI. But of course, this has a lot of negative impact on individuals in terms of side effects and impacting your microbiome. And also with the rise in antibiotic resistance, there's a huge desire to have a natural way of preventing recurrent UTIs. And the science is now very clear that 36 milligrams of PAX daily are just as effective as antibiotics. So what's really neat about this product is they've concentrated it, and 1 capsule per day will do the trick. It contains 36 milligrams of PAX and in a highly soluble form. So this means that the PAX within the capsule reach the bladder and can do their work. And you can see how they work down in the corner there. There's a very scientific diagram there showing the bacteria, the E. coli bacteria that normally wants to adhere to that bladder wall and make itself cozy there and have friends join it. But the PAX, the little red circles, go down and adhere to the bacteria and prevent it from being able to stick to the bladder. So it basically allows a natural flushing of these bacteria to prevent them from multiplying and causing infection. So antibiotic resistance is increasing, and it's a worldwide concern. I really do like this product for the prevention of UTIs. I have worked with many individuals who've had recurrent infection related actually to resistant strains where they actually cannot take typical antibiotics, and they have been searching for natural health products. And so this is an excellent option for anyone who's looking to prevent UTI. So this is an excellent slide to show how this Utiva cranberry pack is a bit different. Not all cranberry products are the same. I can't tell you, even starting in the beginning of my career, how often I've met people just drinking cranberry cocktail, thinking, cranberry juice will help me, when indeed cranberry cocktail has almost zero effect due to a lack of PAX. It's essentially a juice that's high in sugar and very low in the actual cranberry component. You, of course, then can recommend or take cranberry concentrates in a juice or capsule. So that's a very, very sour juice, or the capsules that you can typically find at a health food store. However, as you can see by this diagram, that the typical cranberry capsules have less than 1% PAX. So you would have to take about 9 500 milligram capsules to reach the 36 milligrams that are in 1 Utiva pill. It's also important to note that the Utiva product is highly soluble, again, meaning that those PAX are available in the body to do their job of attaching to unwanted bacteria. So another product offered by Utiva to manage UTIs is D-mannose. So D-mannose has long been known to stop E. coli from adhering to the bladder wall. And I'll highlight that it really only has been shown to work on E. coli, whereas the Utiva cranberry packs work on E. coli and other common bacteria that can cause UTI, which makes the packs more effective when studied. However, D-mannose has, long been around and known to be effective, and research does show that 2,000 milligrams per day does reduce your risk of recurrent UTI infection, and it could be used as an adjunct with the packs. So for those who use cranberry packs and find that they need something else, you can take D-mannose at a separate time of day, ideally, to maximize your benefit from each product. I have met some clients with good results using D-mannose alone. And, looking at the science, you have to wonder if those individuals are really suffering from recurrent infections related to E. coli, as this works specifically on that bacteria. So this is a great slide just showing the recommended treatment and some results from actual users of Utiva. So what they did is they surveyed 500 Utiva users, and 94% actually only required the cranberry packs to prevent UTIs. So for those who have breakthrough infections, they could trial the addition of D-mannose. And the interesting thing with D-mannose is that it's actually dosed in 500 milligram tablets. So as you can see here in the chart, D-mannose can have some side effects like GI upset, so an upset stomach, which is not really cause for concern, but it can also come with some additional caution for those with diabetes, as it is actually a sugar, those with interstitial cystitis, or those who are pregnant or taking hormone therapy, etc. So you want to work with your doctor when you're starting D-mannose, or your health professional pharmacist for some advice. And with this Utiva D-mannose, you can start with a lower dose and work yourself up to that target dose of 2,000 milligrams. Although, there are some concerns with D-mannose in terms of side effects, it's been used for a long time, and it does work. So it's definitely worth trying if you're still needing a product for prevention. Of course, remember to do the basics. Always drink enough fluid, eat well, rest, and follow up with your doctor for any UTI treatment. This is another really, really cool product. So the UTI test strips, Utiva offers these test strips that you can use at home. They're easy and convenient way to test for infection when you have signs and symptoms. Signs and symptoms of a UTI can be tricky. Often people are debating on whether they do have a UTI and should they call their doctor or go in for treatment, or is it nothing? So these are really helpful for use at home to guide you on seeking treatment, and also for those who suffer from recurrent infections and have a need to be quite vigilant in knowing whether they're symptomatic with a positive test. These tests will show the presence of white blood cells and bacteria, which indicate a positive UTI test, similar to the ones they use in clinics. And when you do come back with a positive test and have symptoms, that does indicate an infection, and you want to reach out to your health professional for treatment. One really cool thing about these strips is that that just adds some confidence if you're seeking virtual care, which is more and more common, and or if you're seeing a prescribing pharmacist. Most pharmacists across Canada do have the ability to assess, diagnose, and treat urinary tract infections. And so if you're symptomatic and confirm a positive test with a test strip, that will help your prescriber to confidently treat you. Again, you want to do your basics with taking steps to prevent UTIs as soon as you have symptoms, regardless of having a positive test. Start drinking that water, start eating those vegetables, and consider starting your packs or D-mannose if you're not already on that. All right, so we're going to switch gears and discuss overactive bladder and lower urinary tract syndrome. So symptoms of lower urinary tract syndrome, or lower urinary tract symptoms, include both voiding and storage symptoms. So in addition to feeling the need to urinate day and night with urgency and incontinence, they also suffer from difficulty going to the bathroom. So hesitancy, inconsistent flow, and the inability to fully void the bladder. This is really troublesome for individuals. On the other hand, we have people who suffer from overactive bladder. Now, these are the people that know where every bathroom in town is. They suffer greatly from the storage symptoms of those with LUTS. They have a strong urge to go frequently, day and night, often with bladder leakage. So both OAB, overactive bladder, and lower urinary tract symptoms, LUTS, have a significant negative effect on quality of life and mental health. They really can be downright exasperating. So, um, although considered not to be life-threatening, these conditions are very important to treat, and too often OAB and LUTS go untreated, and it's just not right. I mentioned at the beginning of the talk that I've worked for 15 years with seniors and often the very elderly with complex issues. And it's really unfortunate when I meet someone and their entire day is dominated by their their urinary tract symptoms and having broken sleep and unable to sleep through the night, and difficulty leaving the house because of these symptoms. They can really even impact simple things like being able to eat regular meals or having control of blood sugar and cholesterol, because those things spike when you're not sleeping well. So treating these is important for more than just quality of life. There are health implications. So you can see here that LUTS and OAB are prevalent among men and women, probably more so than is even indicated there, with up to 27% of men living with OAB symptoms, as we know that enlarged prostate and prostate cancer can lead to these symptoms, and that is one of the most prevalent diseases among older men. And of course, we see 43% of women listed there. I also believe that that is higher. Women who have been through childbirth and who are postmenopausal or have had any type of surgical interventions often suffer from these symptoms. And too often they're suffering in silence. And so it's a huge issue, and there are many things that can be done. However, some of them have unpleasant side effects, as noted here. So when you're looking at treating these symptoms and you're looking at medications, we really want to avoid that ideally. And also looking down the road, some people even look at surgical options. And so we want to try and prevent the need for these second and third line treatments by starting with just some basic first line treatments, looking at foods and fluid, and working with health professionals that specialize in the area and can guide those with LUTS and OAB through lifestyle changes. So here it goes over some steps to manage bladder health and improve symptoms for OAB and LUTS. And one trick is actually to eliminate foods that act as a bladder irritant. So acidic fruits and juices, spicy foods, tomato products, caffeine, of course, and artificial sweeteners are known irritants. So what to do is stop eating these foods for 3 to 4 days and just see if it helps. You can keep a bladder record or journal to truly keep track of your symptoms and measure the changes. And if this does not seem to help, don't worry about restricting it. Some people respond differently than others. If you don't need to restrict your diet, don't overcomplicate things. Just move on to another, intervention. Um, we want to always look at fluid, for example. You want to drink enough fluid, but not an excessive amount. Too often, I see people over restricting their fluid so that they don't have to go pee, and that really doesn't work. We always determine that it doesn't actually help. And in fact, it can lead to health issues. It can increase your risk of UTIs, and it can contribute to low blood pressure. So when it comes to fluid, if you're confused on how much or how little, you always want to get actually a definitive fluid goal from your health professional. It's usually never going to be below 6 cups. It'll often be around 8 cups or more. So furthermore, to manage OAB and LUTS, I cannot overstate the importance of managing bowel health, in particular constipation, because it can really have a negative impact on the urinary tract function. Everything is together there in the pelvic floor area, and you want to make sure bowels are moving with adequate fluid, high fiber foods, taking probiotic rich foods or even a probiotic supplement. And as mentioned, other interventions such as prune juice, which is a natural laxative and works well for many. You can also work with a health professional who specializes in this field, looking at things like pelvic floor strengthening or trying to retrain your bladder. And you can look at options such as Utiva Bladder Health, which has actually been shown to help people with these symptoms. So this is the product, Utiva Bladder Health, and there's been a few studies showing clinically proving it improves symptoms of mild to moderate OAB and LUTS. So it's really neat because you just take 1 capsule per day for overactive bladder and 2 capsules per day for lower urinary tract syndrome. And each capsule contains a proprietary product called Flowins. So Flowins is made of a specific blend of cranberry components. And when studied, participants had significant improvements in symptoms with virtually no side effects. So that's really cool and makes Utiva Bladder Health a low-risk option for treatment and something that basically anyone can try. And hopefully it can bring some resolution of symptoms, which are really impairing people's quality of life. So I really like to see this option being available, and I have recommended it to clients and heard good things. So definitely consider it. All right, so we're going to move on now to speak about one of my favorites. So this is the Ferosom Forte liposomal iron supplement, and also the treatment of iron deficiency and iron deficiency anemia. So I wanted to talk both about iron deficiency and iron deficiency anemia today because both are important, and often we're not talking about iron deficiency. It's less recognized. However, it's 3 times as prevalent as iron deficiency anemia. So iron deficiency can accompany symptoms that overlap with anemia. However, when you're deficient, you're just running low on your iron stores. You're not quite anemic yet. So when you're iron deficient without anemia, your blood work will often show what's a ferritin, which indicates iron stores below 30. That usually indicates a deficiency, whereas a ferritin below 90 with symptoms of iron deficiency can indicate suboptimal levels. So it's a little bit less common to be treated, and I really see people suffering with symptoms that fall in this range of ferritins, below 30 even. I mean, here in Alberta, they're not going to flag you until you're lower than 14, or even those running, around 30 or 40 will straight up present with symptoms like iron deficiency anemia without really receiving guidance on that or treatment. Of course, iron deficiency anemia is more recognized. It's when your iron stores have been completely depleted. It's the most common nutrient deficiency in the world, and it's detected by blood work that will really show a low hemoglobin, or those oxygen carrying cells are low, and also something called the hematocrit, or the percentage of red blood cells in your blood, will be low, among others. And this is often caught by physicians with blood work, prompted sometimes by symptoms or maybe routine checkups. And this is more commonly treated, as it's known to need immediate and aggressive treatment, really, to restore iron to levels that can support your oxygen carrying cells. So you can certainly appreciate the symptoms noted here as being important to treat, regardless if you have iron deficiency anemia or iron deficiency. Fatigue and weakness, having pallor, The worst anemia will present with cravings to eat ice or even non-food items like clay or dirt, which is called pica. And then, kind of more subtle complaints that often you'll see with just iron deficiency will be the difficulty concentrating, irritability, and low mood. So this is particularly important for anyone who suffers from anxiety or depression, or for my kiddos that I work with who struggle with behavior at school or learning disability or different neurodivergent diagnoses. You need iron to make serotonin. It's just a fact. Also, early signs that will show up will be restless legs or difficulty sleeping. Finding sleeping more restless and unsettled can indicate iron deficiency or anemia. And it's also well established that chronic disease symptoms are worsened with lower iron stores or below optimal iron stores or iron deficiency. So this includes people who have heart failure, fibromyalgia, hypothyroid, and others like irritable bowel disease or even chronic infection diseases. So anemia is complicated, and you want to have guidance to actually diagnose it and start some treatment. So if you have symptoms like this, it's really important to seek advice from your physician and get some labs done. It's also important to note that you can and you should learn your own blood work results. You Most of us can access our own health records online in various ways, or you can request results from your doctor's office and you can ask them to really discuss the results. So for example, I mentioned ferritin up above. Ferritin's important to know. It should be checked to determine if you have low iron stores or iron deficiency, which may benefit from either some dietary changes or more likely a supplement. And you do have to have ferritin measured. And also you want to know if your hemoglobin is low and you're truly anemic, and to follow up once you start treatment to see if your treatment is making a difference or if it needs to be adjusted. So if you have any of these symptoms, promise me that you will work with your primary care provider to get some treatment. So I would be remiss if I didn't talk about our iron-rich foods. Here's a nice collage of lovely iron-rich foods. It's important to note that there's two types of iron. Heme iron is coming from animal-based foods and has a very high bioavailability for the body. So the body absorbs this very well. So eggs, meat, and poultry, of course, are rich in iron, but clams are exceptionally rich in iron, and fish are also an excellent source. And most people don't consume adequate amounts of omega-3 fatty acids. So choosing fish rich in this healthy fat can help to meet both iron and omega needs. So you can choose fresh, frozen, or canned salmon, mackerel, anchovies, sardines, herring, tuna, or trout to increase the iron and the omegas in your diet. And a good way to remember that is with the acronym SMASHED. Oh, I think I missed a T. There's supposed to be two T's on the end of that. If you eat any of those foods, go ahead. They are brain food and they are high in iron. They're exceptionally nutrient dense. Many people are familiar with non-heme iron, especially if you follow a vegetarian or vegan diet. These are your plant-based sources, and they are less bioavailable, but they are also abundant in many healthy foods. So you can find them in non-heme iron in beans, peas, and legumes. Your dark leafy greens, pumpkin and sesame seeds are exceptionally high. Blackstrap molasses and whole grains such as oats and quinoa. In Canada, we also fortify wheat flour with iron, so that makes pasta and enriched cereals a great choice for additional iron. You just want to flip over the package and have a look at the percent daily value. Higher is better when you're looking to get more iron in. And also to enhance absorption of non-heme iron, you can pair it with a source of vitamin C, such as citrus fruits or strawberries. Cooking with cast iron cookware can also provide iron in the diet. That's actually very true. There's even a made in Canada product called the Lucky Iron Fish, which some people purchase, and you just put it in your cooking water. And because it's made of cast iron, it enhances the iron content of your food. Pretty neat. So you can find out more about iron and iron-rich foods by visiting that website, unlockfood.ca, by the Dietitians of Canada. So here's a very sciencey picture just to show you how most iron supplements and iron from food is absorbed in the body. So they're only partially absorbed, and that's because there needs to be a specific channel in one area of the gut that the iron travels through. So this is a picture of the cell that lines the intestines, that all food must travel through the cell and all nutrients must travel through the cell to reach our gut. And this is showing how non-heme iron has about a 10% absorption rate, where heme iron has about a 30% absorption, and those are actually maximum. They can be less than that. So lots of things can impact iron absorption, including the acidity of your stomach, which can decrease with use of antacids or with age. It can also be impacted by taking iron foods with dairy, or taking iron with phytate containing foods like coffee or tea. And this is also true for when we take iron supplements. So iron supplements are only partially absorbed through these channels. And that leaves unabsorbed iron in the gut, which leads to upset stomach, black stools, and worst of all, constipation. So as a result, many people don't tolerate traditional iron supplements, which are often prescribed with vitamin C unless you're taking like a non-vegan heme iron. And this kind of intolerance leads to people just not taking their supplement or suffering through significant side effects. So then I made them and they're not seeing their anemia or iron deficiency improving. And it's if this is the case for you, it's just so important to follow up with a physician to explore, options of supplements you could use, or maybe you're on a supplement that's not working, you can change to another one. And when I learned about Ferosom Forte, I was just over the moon. It's a really great alternative because it's completely different. So here's another very sciencey slide, but it's showing you how Ferosom Forte is absorbed completely differently than other iron. So it's absorbed by endocytosis, which basically means a little Pac-Man in the gut lining comes out to grab that iron and bring it in. And that's because the iron is in a very tiny lipid bubble. And so when you consume Ferosom Forte, it travels through the gut, protected, and reaches your intestine, unaltered, where just goes bloop and is absorbed into the body. That leaves a minimal amount of free-floating iron in the gut. So it is very different, very fancy, and very excellent. So the absorption is actually shown to be almost as high or as high as IV iron sucrose when we're looking at the efficacy of the liposomal iron, Ferosom Forte, and that's because of its formulation, that unique liposome that it's carried in, and the unique absorption pathway where it can be absorbed anywhere along the intestine tract. It also is having minimal to no side effects because there's very little to no iron left in the gut to bother you. And it also is so easy to take because this iron does not require, avoiding taking it with different foods or drinks, making it so that you can take it anytime. Doesn't matter if you're having caffeine or dairy or eating a meal, etc. You can feel confident taking this and that your body will absorb it. So here are the capsules that are available. So they come in a 30 milligram elemental iron capsule. When you're looking at iron supplements, again, this might help you if you've ever looked at the milligrams of iron in various supplements. It can vary widely, and that's because various forms of iron are absorbed at different percentages. So this is near 100%. So the actual dose that you're getting is near 30 milligrams. Whereas if you're looking at something where you're only getting 10%, you would have to take 300 milligrams of that.
Okay,
The capsule here for Ferosom Forte is also very easy to swallow. My children actually can swallow it just fine. It's small and it's not tough. They are vegan, gluten-free, halal, non-GMO, and they're also made in Canada, which is really cool. You can get them at the Big Carrot as mentioned, and you can also order them online. They're an excellent product for pregnant women, breastfeeding women, and then individuals of all ages who are needing an iron supplement.
Okay, so just being time conscious, we can probably wrap up in 3 more minutes
Sure.
or go straight to the Q&A.
I think we are done. Yeah, this is the last slide. Yeah, so this is just showing the sachet, which also delivers a good dose of iron, but it's in a form that's like a powdered sugar, and you can actually directly eat it or mix it into a soft, moist food for an easy source of iron. It's especially great for kids. My kids actually love this. Everyone loves it, and that's what this slide shows. And then I believe we're on to questions. Sorry, I do tend to talk extra.
No,
I
that was
always do that. Sorry.
Thank you, Kelly, for such a great talk. We
Thank
will
you.
go straight to Q&A. So the first question is, how can we get a dietitian?
Oh, well, there you go. You can visit depending on where you live, in Canada, you can get referred to a dietitian through your doctor and your public health authority. Normally they'll have them in primary care, etc. But you can also reach a dietitian privately through like dietitiandirectory.com, and about 80% of health plans do have coverage for dietitians. So if you have private benefits, you can check there.
So the other question, why do sometimes I still get UTIs on Utiva?
Good question. You know, it's not 100%, right? So for for your individual, situation, you would want to work with a healthcare professional to really assess what is going on right now and where do you have to gain. That's all I can say about that. Definitely fluid is key.
Yes.
You may also want to try the D-mannose, I guess.
Yeah, I was just about to say that.
Mhm.
Our internal data suggests that 96% of people who take Utiva cranberry packs daily suffer a significant reduction of UTIs, but there are many underlying health conditions that people may have, such as vaginal atrophy, diabetes. So we suggest that you can complement with either Utiva D-mannose or Utiva probiotic. And if you're still having issues, then maybe you want to consult your healthcare practitioner or Kelly. So the next question, what are the specific probiotics you recommend for bladder health?
Yeah, so probiotics in Canada, there are a range, and you can trust a product, natural health products in Canada. They're highly regulated. Utiva does have a probiotic that you can check out. It's available on their website. Off the top of my head, I would have to consult, look each product up, because you want to make sure that the probiotic that you're taking is specific to the concern you're trying to treat. That's exactly how probiotics work. Another really good Another good resource is called the Canadian Probiotic Guide, which is a free resource that walks you through probiotics that are clinically effective in various conditions.
What are the specific, oh, I already mentioned this. Are there dietitians that specialize in bladder health?
I saw that question, and that's a really good question. So, in private practice, like if you go to dietitiandirectory.com, there will be dietitians that niche in that area. In also, you'll meet these dietitians if you're involved in clinics that specialize, for example, in urogynecology or perhaps just gynecology. You'll also meet, dietitians like me that just work with people who are have conditions that are chronic health issues that are prone to having bladder issues. But certainly the answer is yes, they are out there, and usually you'll find them easier through private practice, and you can find them on dietitiandirectory.com or even Dietitians of Canada .ca and just search for your specific issue. You can meet dietitians online quite easily. They will need to be registered in your service area or province.
My naturopath has suggested both cranberry juice and Utiva capsules. Any harm
Mhm.
in taking both at the same time?
No, I would say no. I mean, like, the cranberry juice and cranberries have other health benefits, right? So I would say that the cranberry cocktail, like ocean spray for etc., is not going to give you health benefits other than tasting delicious and giving you some fluids. And then the cranberry juice is actually quite tart, so I don't know how much you could take of that, but depends on your taste preferences. But there's no harm in doing both.
Can we take cranberry pack and the manos at the same time?
Yes, you can, but you actually don't want to take it at the same time, if that makes sense. So you can take both products, but you want to offset the D-mannose from the cranberry packs. I think it's by at least 2 hours. And that's so that you're not, interfering with one another because they have similar mechanisms. You want to maximize your benefit from both products by spreading them apart.
How high in vitamin C is Utiva? My bladder is sensitive to citrus fruits.
I actually don't know the answer to that. Um,
For us, do you know the answer to that?
Hi, everyone. Just went off mute there. You know what? I was just checking because we do third-party testing of all the ingredients inside
mhm,
our Utiva products, and we don't add any vitamin C, and we don't have any particular traces of ascorbic acid within our.
right.
But cranberries in general are acidic, so if anybody is worried about, citrus related fruits, and cranberry can be acidic too, right?
Mhm.
Um, it could aggravate the bladder if they're concerned about it because cranberries are acidic. Our recommendation is take an alkaline along with it, whether it's alkaline water or anything in general, because you want that you want that pH balance in there
Hmm.
to avoid any sort of issues. So that's because the number of interstitial cystitis patients do take Utiva cranberry packs, but they're taking it for the benefits of UTI prevention. But take an alkaline with it to help minimize any effects of the citrusy part of the fruit.
Thank you for us.
Good
Any
answer.
any harm in taking 3 capsules of Utiva cranberry packs a day at the same time?
Hmm. I don't
Well,
think it's been studied in that way. Like, the studies are showing one per day. Some people take two if they're experiencing a known trigger. Some people have certain triggers, it could be intercourse, it could be a hot tub, um, it could be whatever it may be, and they'll increase the dose to two on the day of or the day after. But to take three per day, I'm not sure if it incurs additional benefit. Might
Yeah,
depend on the individual.
you're absolutely right, Kelly. There's no there's no documented benefit. They won't cause you any harm, but then what's the point of spending your money to put 3 capsules if there's no documented benefit? So it's up to the patient, it's up to the customer and the patient to consider, but there's really not any particular need for it. So yeah, I agree.
I just put in the chart in the chat, it's probioticchart.ca. So that's the clinical guide to probiotics, the products available in Canada. It's not all products, but it's a good place to start.
Would Dimanos affect interstitial cystitis? Would it help with biofilm?
I am not 100% sure on that. I would suspect that the answer is yes. You need to talk to your doctor regarding D-Manos and interstitial cystitis because for some people it wouldn't be recommended. It's something to discuss though.
Well, internally, we know that it doesn't really affect IC, but there is evidence that it does help with biofilm, if that helps with anything. Can certain foods cause high nitrates to show up on a test strip? Cabbage, for example?
I'm going to go ahead and say yes. And with test strips, you know, the key there is that you have to have symptoms, right? So many people will have a test strip come back positive, but without symptoms, that's not usually cause for concern. I'd have to do more research on specific foods and quantities, etc. But definitely what you eat can impact your urine. And that's why, you know, cloudy urine is not necessarily indicative of an infection because food can actually cause that.
For overactive bladder, are Utiva cranberry packs just as good as Utiva bladder health pills? Is the first less full spectrum, and what would that matter?
I'm going to go ahead and say no, they're actually different and they've been studied differently. It's actually really cool, the Flow-Ins product that is for the Utiva bladder health. They have different mechanisms, and it really depends on your primary symptoms and what you decide to take. Anything to add to that?
Well, oh, okay, I'm gonna let Faraz answer.
Yeah.
Sure, no problem. We get this question a lot. It's a great question because both are cranberry based, but they're absolutely different products altogether. One for the UTI one that says Utiva cranberry packs only focus on the active molecule from the cranberry, which is proanthocyanidins. In the bladder health product, there's almost very, very little packs. It's all full spectrum part of the cranberry. For the other mechanism of action, as you said, Kelly, like they both work very differently. So the bladder health product has a completely different range of parts of the cranberry in it. So they're completely different. They shouldn't be confused. The bladder health is for overactive bladder, and the Utiva cranberry packs is for preventing UTIs.
Good question.
If you have a UTI, what shows it most? The bacteria or leukocytes or nitrates?
It's the symptoms.
Okay.
Other than that, I'm not sure. You'd have to speak to a doctor. Bacteria would be my inclination, but really what's key is being symptomatic. And then when they test, they really are looking for a certain concentration of bacteria.
Somebody said one should not take the manos longer than 6 months. I'm not sure if there was a question in there, but
yeah, I'm not sure about that. I mean, D-Manos has been around for a long time. I'm not, that might have been something unique to that person. As to my knowledge, it is safe to use long term. I mean, in the studies that I was reading, they are looking at using it for, you know, 6 months, 1 year, because they're looking at prevention of recurrent UTIs over the long run. So it should be safe to take, and you can always consult with your, you know, your doctor or pharmacist or health professional on that.
Okay, so we want to thank Kelly for her time, the Big Carrot, and all of you for your questions. We will be sending out a survey tomorrow to see your feedback on the event. Please take a few minutes of your time for feedback. Also, we want to mention that until the end of the month, there is an in-store promotion at the Big Carrot with 15% off for both Utiva and Ferosom. And for anyone not in the Toronto area, we also have a new customer discount on our website. Good night and thank you.
Thank you.
Thank you, Kelly. Thanks, Jen, and thanks Big Carrot for allowing us to be able to host this webinar to all of your customers, and appreciate everyone joining in. Thanks so much again, Kelly and Jen. Good night.
Bye.
Bye.